Arthritis is silently affecting thousands of Ugandans, limiting mobility, productivity and quality of life, especially among older persons, manual laborers, and people living with chronic conditions. Health experts warn that while arthritis is often dismissed as a disease of old age, it can affect people of all ages if left unmanaged.
We talk of arthritis. There are many conditions. Arthritis means a painful, swollen joint. Okay? Now, painful swollen joint can be caused by many things. One of them is like wear and tear. I mean, the cartilage is worn out and literally you have a wound rubbing on a wound and keeps weeping, and then you end up with fluid in the joint and makes noise and makes walking difficult. But arthritis can also mean that infection, bacteria, pus-forming organisms entered the joint through many other things. Maybe somebody injected some medicine or aspirated, tried to draw out fluid, water from the joint, and then ended up contaminating the space inside with bacteria, and you form pus inside. That is also called arthritis, pyoarthritis, or pus in the joint.
Arthritis is an umbrella term for more than 100 conditions that cause joint pain, swelling, stiffness, and reduced movement. The most common forms in Uganda are osteoarthritis, linked to aging and joint wear, and rheumatoid arthritis, an autoimmune condition that can begin as early as young adulthood.
Arthritis is an autoimmune, meaning the body is fighting itself. Rheumatoid arthritis, there are many theories about its causation, but the most plausible theory is about the one of mimicry, that the organisms that cause sore throat, cough, or urinary tract infection have a capsule, a covering, that has a similar resemblance to the cartilage, the lining of the joint. Okay? Now, once that bacteria is cleared, either by your own antibodies, which the body forms soldiers, either the cells or fluid that can fight that bacteria. Once it's challenged, they continue identifying now the cartilage in your body like something which is like the other bacteria. And then the body begins fighting itself. And then all joints are affected. The small joints, the big joints, and even the joints in the spine. And then you have that pain that you just keep dampening the activity of your fighting cells. So it doesn't clear completely. The other forms of arthritis, there are really many. There is one which comes as a result of eating too much red meat. And many people think pork is not red meat. Pork is red meat. You have goat meat. You have beef, which is from the cows, even from camels. That people who love nyama choma or love eating pork every evening and drinking alcohol tend to have pain in their joints. And most times when you do what we call uric acid levels, they are elevated, meaning they have gouty arthritis, and it's disabling.
Dr. Ekure explains that delayed diagnosis remains a major challenge. Many patients seek medical care only after prolonged pain, relying first on self-medication or traditional remedies, by which time joint damage may already be advanced.
I have seen a young doctor whose hands actually can't, because he's formed nodules, they're contracted, they're swollen and they're painful. The doctor can't work. He has knowledge in the head, but he can't work because the disease has disabled him. There are many problems that people end up with. And sometimes this is the era of the internet. And many patients, before they come, they Google, they first consult Dr. Google and come here. I had a very nasty situation here not so long ago. A patient was seen at one of the hospitals in Kampala. She was told of the condition. She was referred to another hospital. They chose to come to Kumi. They had read about us on the internet and all these things. Unfortunately, when I confirmed what she was told in the first hospital, that this was the problem, patient collapsed. I mean, the mother of the patient collapsed in my office here. And I asked, why would this happen? She said, that's exactly what I saw on the internet. And then they say this disease is incurable. These diseases we are researching every day. Even the ones which were said to be incurable, some of these days now have a cure. Eh? So you have to be very careful as you read for yourself and as you discuss with the doctor.
Risk factors include aging, obesity, previous joint injuries, repetitive heavy work, and a family history of arthritis. Specialists emphasize that lifestyle changes, such as maintaining a healthy weight, regular low-impact exercise, and balanced nutrition, play a critical role in prevention and management.
So it's a disease that people should avoid by just cutting down on how much meat they eat, how much alcohol they drink. And unfortunately, that's the only time we tell you to do less exercise or no exercise at all. But there are also some green vegetables that can produce what we call purines that can actually still lead to rheumatoid arthritis, to gouty arthritis.
Treatment focuses on pain control, reducing inflammation, physiotherapy, and in severe cases, surgery. Health workers urge the public to seek early medical assessment for persistent joint pain lasting more than a few weeks. As Uganda's population ages and non-communicable diseases rise, experts say strengthening early screening, patient education, and access to physiotherapy services is critical to reducing the long-term disability caused by arthritis. Walter Mwesije, NTV.